Welcome back to our hip series. If you're an active individual, an athlete, a fitness enthusiast, anybody who just is trying to stay moving and active, we've been talking about hip pain the last couple weeks. Remember, the hip joint itself is where our leg bone, our femur, attaches into our pelvis. It's called our femoral acetabular joint. Our treatment options we have in the clinic. So if we determine the hip pain is actually coming from the hip, we've got a few different treatment options we use. One of the options is I've been certified in what's called active release technique now for 13 years. So we will use kind of a hands-on technique to get into the muscles that are sore, stiff, and achy to try to get those to kind of relax, release, and calm down so the body can heal and feel a little bit better as we go. One of the other treatment options we also use, cart kind of here on my side, we've got our dry needling stuff here. We've got various sizes of needles. We've got a couple E-stim units. We use this to really kind of get into sometimes the really sore areas. We can use this right in sore areas to get stuff to calm down. Other times with the dry needling, there's different techniques. We can use this to get into areas that aren't actually sore, but can actually get to these sore areas. We use these in areas that aren't actually sore to get these sore areas to calm down, to relax, to feel better. We can also use these to get into areas that, if it's a hip issue that's actually coming from the low back, we can actually do some stuff in the low back and the hip at the same time. We can hook the E-stim unit up and affect a lot of big different stuff all at the same time and help the body to heal, relax, and recover. Other options, I'm a chiropractor. We have some options to actually do some hip adjustments. This is what my little drop piece is. We can do some different mobilizations and stuff with the hip joint itself. We can also, got the option for massage gun. We can also use some of my favorite stuff. It's called Rock Sauce Fire. It goes on a little bit cool. It gradually warms up. But one of the other reasons I really love using this stuff is that as soon as we apply that onto the skin, we can also toss some kinesio tape, some stretchy tape on top of that. A lot of times too, that will help stuff to calm down initially, especially after the initial injury when everything starts to hurt. One of the things that we really try to do if it's a brand new fresh injury is we try to make the body feel happy, healthy, and safe, because that's when healing is going to really start to happen. And then once that starts to happen, then we can get into some of the hands-on stuff, the ART, the dry needling, more of the active recovery stuff that you can do at home. Treatment option-wise also for this is going to be some home exercise. So if we determine the hip joint is actually causing the hip pain problem, we're going to be having you do usually 1 or 2 hip exercises at home just to make sure. We wanted to make sure that hip joint stays moving is going to be the big thing, especially the further into treatment we get. And then as that starts to move better, we can incorporate in some more of the active stuff again, whether it be squats, running, kind of getting back to your normal day-to-day stuff. If it's coming an issue from the low back, very similar stuff. We can use the dry needling, like I said, in the low back. We can use some ART for the low back and kind of around the hips to help a lot of the big muscles in the low back to feel calm, relaxed, and safe. We definitely adjust the low back all the time. We can definitely use tape and stuff like there as well. So depending on once we get an idea of where the pain's coming from, we can definitely, we've got multiple techniques to get in there and really start getting things to relax, calm down, and helping you feel better as quickly as you can without having to go through drugs, without having to go through injections, without having to go through surgery.